Thank you. Thanks for that. Hello again, everyone. Today I'm going to present my planned or proposed postdoctoral research that I hope to do starting this fall in the partnership grant. And it's still in the area of return to work among injured mobile workers, but now going forward is going to be looking specifically at impacts on families and caregivers. And this particular research focus grew out of other related research that I'm either involved in or connected to. And I'm going to review here 3 projects or programs of research that have produced relevant findings that really point to a need to better understand the impacts of return to work for mobile workers on families and communities. And so these 3 projects or programs of research suggest that 1, work mobility does impact families and communities. And secondly, that persons with disabilities, including those with work-related injury, do rely on family support. And finally, that return to work for injured mobile workers have impacts on families and communities. An important body of research that informs this proposed study comes out of On the Move, which Barb and Catherine described yesterday. So it's a multi-year, national-scale program of research that is looking at the effects of employment-related geographic mobility on workers, families, communities, employers, and the different levels of government. And as Barb and Catherine noted, On the Move really looks at that full spectrum of mobility, including home-based work or extended daily commutes, including those in urban settings on public transit or regionally, as well as those longer commutes across provincial and even national boundaries. And basically, this program of research has revealed a number of impacts of work mobility on families and communities. And it's identified, for example, the ways that mobile work disrupts households and communities. So it identifies impacts on physical and mental wellness. It lays out specific impacts for the children of mobile workers, as well as the grandparents who oftentimes take up the caregiving of those children, as well as financial costs associated with travel, elements of the travel that the workers oftentimes take on themselves, as well as challenges associated with lone parenting when one parent is frequently away. And the research coming out of On the Move also identifies the number of community supports that are needed to support these families experiencing these various impacts. So it identifies that mental health and addiction services are needed and counseling and support programs. It also highlights the need for these nonprofit volunteer-based community supports. So, there are plenty of support groups for oftentimes the moms who are taking on the full load of responsibility at home when their spouses are away. Also supports within the school system to really support those children who are affected by work mobility when one or sometimes both parents are frequently traveling away for work. And finally, supports around transportation and property maintenance. Again, when you've got lone parent households, these sorts of things become really challenging. An additional study that suggests family and communities may be impacted by return to work is my current postdoctoral work, which is looking at the ways work mobility, so travel to work or within the course of work, is supported or not for people with physical disabilities. So I'm really looking at the policies and programs in Newfoundland and Labrador and in Ontario that support or hinder the work mobility for people with physical disabilities. So I'm looking at both people with work-related injury and disability who are trying to return to work, as well as with people with disabilities that are not related to work and who are trying to engage in the workforce. So what supports are there specifically around transportation to work and to address any accessibility issues and transportation issues they have. And so this study is ongoing. Data analysis and collection is still ongoing. But the findings to date suggest that generally work mobility for people with physical disabilities is not well supported. And it's largely considered a personal responsibility outside the obligations of the Workers' Compensation Board and the employers, even when that transportation is required to accommodate a work-related disability. In regards to formal supports for people with disabilities to engage in work mobility, they're generally experienced as inadequate, and certainly there's a lot of variation in terms of regional availability and adequacy. They're oftentimes restricted, and where available or even adequate, they might not be portable, which can really constrain your mobility. So if you move, for example, you might end up having to forfeit or give up the supports you've been enjoying in a particular community, or even at a particular address. And oftentimes, of course, these supports are means tested. So if somebody does successfully begin to enter into the workforce, they may end up losing really important critical supports, for example, like funding for mobility aid and that sort of thing. So what happens then is people with disabilities who are trying to engage in work mobility often bear the burden of paying for and arranging supported transportation themselves. And they oftentimes rely on family and community and more informal social supports to, first of all, navigate the variety of systems that they're trying to access, and also to accomplish that mobility. So they're relying on spouses or parents to get them or their children around into the places they have to be. And then finally, the study which I presented yesterday, looking at the experience of return to work for injured mobile workers, is definitely informing this proposed work of mine, because as we were going through it, impacts on families really began to emerge, some of which I covered yesterday. So just to quickly sort of reiterate, we found that this is speaking to mobile workers themselves about their return to work experience. They reported on, extended absences from home, either related to extended time in the work province to recover or to undergo surgery, or also to participate in return to work, or sort of retraining programs and that sort of thing. And that, of course, led to extended periods of time apart from their family. They also described, these mobility being shifted onto families. So in cases where they would have to stay in the work province, their family would be flown up for Christmas, for example, or certainly their wives or spouses would oftentimes leave their home province and go to the work province to support their loved one. They spoke again of financial consequences of essentially depleting the family's savings to pay for healthcare treatment in the home province when that wouldn't be supported by the compensation board in the work province. And they described new caregiving responsibilities, again, spouses having to take on this additional role of looking after their loved one. So the objective then of this planned postdoctoral research is to examine the consequences of mobile workers' return to work experiences and processes for their family and home lives from the perspective of family members. So this would be a qualitative study that would involve interviews with family members of injured mobile workers, and that would include spouses or partners, children, and also grandparents, parents, caregivers, and or the recipients of care. So in some cases, a mobile worker might actually be a caregiver themselves. And once that routine gets disrupted as a result of return to work, that caregiving responsibility also gets disrupted. These interviews will explore, from a gender lens, issues such as parenting, mental illness and addictions, household income, and, as I say, caregiving and other responsibilities that are affected by the work absence or return to work process that disrupts this family's routine. In this study, I would also consider the effectiveness of those community supports that are available or not for injured workers and their families. In order to manage these various challenges, I hope to sort of identify or discuss in the interviews. And I also plan to look at aspects of the return to work policies and procedures that either support or complicate or possibly even disregard family and caregiving needs and obligations. And then finally, I want to conclude my presentation, I guess, with an invitation for comment or thoughts from you. My initial plan was to interview family members, possibly one-on-one, but strictly the family members alone, but I think it would be really interesting to interview family members and the workers together. But I recognize that that has implications certainly for the things that are said or not said in that group interview, as well as some ethical considerations that need to be considered. So perhaps when we open it up afterward for conversation, I would like to hear from anyone, certainly who's interviewed families or might have thoughts around this sort of approach, and especially from any injured workers in the group who, if you could imagine participating in an interview with your family members, would that cause you any concern, or would you really look forward to that sort of thing, I guess? So thank you.
Thank you.